listen to the doctor, whatever the doctor is saying or anything. Okay. So hence we can relate to it, and be it any all the subtests included in OET like listening, speaking, writing, reading, all are based on medical scenarios. So it's very easy to for us to take it. Okay.
Ma'am.
Okay,
Ma'am.
so this OET is in this exam, your professional knowledge won't be tested. It's basically your English proficiency will be tested. Okay, so here you won't be asked about the medications, the list of medications like what is PCM, what is azithromycin used for. If a patient comes to you, you won't be directly saying like take this medication, take that. It's not assessed like that. Okay, it's basically how well you communicate with the patient, right?
Yes, ma'am.
Yes. So here you won't be asked about the medical terms like atherosclerosis, aneurysm. It won't be that. It's basically not a competitive exam like how we gave NEET and everything. It's not that. It's just a thing that you will be assessed on this score you need to get, and you are just cleared. So it's not a tough exam. It's very simple as long as you give it just 1.5 hour every day to this. And there are here also you will be like if we are talking about speaking subtests, you will be assessed on your language. Your English language will be assessed like how are you pronouncing a word, how are your spellings while writing. Okay, like we have writing subtests also, so how well you are writing the letter. In listening, you will you need to hear the patient's main problem, like how well you can just note down the minor clues about the patient, and then you can just write it down on those blanks which are given on the listening tests. Okay, in speaking you will be assessed about how well you communicate with the patient. Okay.
Yes, ma'am.
Okay, so
Yes, ma'am.
may I know you all have given OET before? Anyone who has given OET before?
No,
Mhm.
ma'am.
No, ma'am.
No. Okay, so you all are preparing it right now. Okay.
Yeah.
Yes. So you all have any idea how many subsections are there in this exam?
No, ma'am.
No. Okay. Okay. So I will give you the overview of this exam. Okay. So basically, OET consists of four subsections. How many?
4 sections, ma'am.
Four subsections. Okay.
Okay, ma'am.
Yes, ma'am.
So that includes listening,
Listening, speaking.
speaking,
Writing.
yes, then
Writing
writing,
and
Reading.
reading.
and then
Reading.
reading. Okay. Okay. So as I have told you, you need to practice it from today. Okay.
Okay,
Whatever
ma'am.
we discuss, and I will share you the official OET site also where you'll get materials. Okay, so you can download from there, and then you can look into that. And if you can just look into those documents. Okay, and then if you find it difficult, just close it, and I will be discussing with you everything. Okay.
Okay,
And
ma'am.
it's like you need to practice it every day, and once if you go about for a week, then at the end of the week you'll understand which is your strongest subtest, like of all those of all these four sections, which is your strongest and which is your weakest. Okay,
Mm.
so it's like if your speaking is weak, Then what we can do is, before starting a class, every day one student, you all can communicate with each other if it's fine, or else you all can communicate with me. Okay, I will be available. So before starting each session, we will be talking to you. I will be talking to you. Like, I can just give to one person, and then I can just talk to them about. If I'm talking only about speaking right now, okay? If you all think that speaking is your weak side, then I can communicate with you, okay? And then we can go about, and then we can see if it's helping you all out, okay?
Ma'am.
Okay. So, have you all prepared any subsections?
No, ma'am.
No. Okay. 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 So let's start with the slides. Okay. So whatever I've told you just now, is it clear? Do you all have any doubts?
No, ma'am.
No, ma'am.
No. Okay. Okay. So do you all know OET is accepted in which countries?
UK,
Yes.
Australia, I think.
Yes.
and Canada.
And what else?
I think Canada.
Canada? No, no.
No?
New
Then New
Zealand?
Zealand is there.
Yes, New Zealand.
Okay. So basically, OET opens the door to international professional advancement. Okay. Like, you can pursue this profession in English speaking countries, right?
Yes, ma'am.
Okay. Okay. So, basically, OET, how does it help us? Can you all tell me how OET exam help us? Like, what can we learn? Hello?
Yes,
Hello?
yes, ma'am.
Yes, yes. So can you all tell me how OET helps us? Like, what are the things that we are prioritizing before, like, I'm starting classes today. So what are the things that you will be learning? So it enhances your communication abilities, okay?
Ma'am.
So why communication is important? For what do we need to communicate properly? Hello? Hello?
Yes, ma'am.
Yes, yes. So why only one person is unmuted and I can't see Binuja?
Yes, ma'am.
Yeah, hi. Binuja, tell me why we need to communicate, why we need to learn proper communication. Can you tell me? Hello, Binuja.
Yes, ma'am.
Yes, yes. Tell me why we need to communicate properly. Okay, okay, no problem. Then it's like, for effective patient care, we need to communicate, right?
Yes, ma'am.
Yes, like effective patient care. Like if a patient is come to you and the patient is saying, I am not feeling well, how will you go about it? Will you not ask the patient what happened? When did it happen? When was the last time you had your meal and everything? So proper history and everything will start with what? Effective communication, right?
Yes, ma'am.
Yes, Binuja?
Yes, ma'am.
Yes. So we need to communicate properly. So through this OET exam, we will be learning to communicate properly to a patient, okay?
Okay, ma'am.
Okay.
Yes, ma'am.
It also this test also ensures that the practitioners which are you all nurses can convey information clearly and accurately, okay?
Yes,
So
ma'am.
it's like it's not just communication, it's also how it has to be clear, right?
Yes, ma'am.
It has to be accurate. If you are saying the patient needs to, if you are explaining to a patient that this medication needs to be taken, then you need to explain to the patient like why is it necessary, why, if you don't take this medicine, what can happen, what are the consequences, right?
Yes, ma'am.
Yes. Yes, so you all have done BSc.
No, ma'am.
No,
Yes,
Okay.
this
ma'am.
year.
Okay. Who has done BSc and all others like
Ma'am, me, Binuja.
uh, Binuja, you have done BSc.
Yes, ma'am.
Okay. Again, Asma.
I'm doing this year.
Okay, you are doing. And Deepika,
I have done PCL nursing, ma'am.
what you have done?
PCL nursing, ma'am.
Okay, good. And Nanu?
Me also same ma'am. PCL nursing.
Okay. Okay, so you all have done from Nepal, your BScs and this course?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay. 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 So, do you all have idea about this, the subtest, about different subtests which I have told you just now? Like how many minutes are assigned to each subtest?
No, ma'am.
No, ma'am.
No.
No, ma'am.
Okay, fine. So first we are going with listening, okay? So listening is a 40 minutes audio. Okay, it's a 40 minutes task. It's like 40 minutes are assigned for listening. Okay.
Okay.
So basically in this, have you all watched any videos on this listening and like all the subtests on YouTube and all? Have you all watched?
Ma'am, I have done.
Yes.
Okay,
Yes.
okay.
Little
Okay,
bit.
so what are the audios which are played?
The conversation between the nurses or healthcare
Healthcare
trainer.
related audios. Yes,
Yeah.
yes,
And then yes.
yes. Okay. So, how was it, Nanu? Like, when you heard it, how was it? Were you able to capture those important things?
Yeah, because in the listening that we have to
Uh,
uh, uh, speed up about the the like
yes, yes,
capturing the um, yeah
yes.
what
Yes. You need to pick up the important information
yeah
while listening to the
Yes,
patient, right?
yes, ma'am.
yeah
Yes. So now we have reading. Then reading is assigned for 60 minutes. Okay. It's almost 1 hour.
Report ma'am.
Okay. So what is done in reading? Like what are the tasks which are given? You all know? Reading, what are the tasks which are given?
Passage is given, then we have to read the passage and answer all the questions below.
Yes. Yes. So
Yes,
basically
ma'am.
it's medical comprehension tasks, right?
Yes, ma'am.
Yes. So it's related to medical only. a paragraph is given, then we have to read and answer the questions and MCQs with the MCQs, right? Okay, okay. Then we have writing. Writing is assigned for 45 minutes. Okay. And then there are different writing letters, like most of the time it's referral letter. We can also get discharge or maybe transfer letter, right?
Yes, ma'am.
Okay, okay. Then last we have speaking, which is assigned for 20 minutes, right? So basically, two role plays are given in speaking, and it's basically on medical environment, right?
Yes, ma'am.
Okay, okay. So which is the subtest which you all feel is tough or is easy for y'all? So I'll go with Asma, okay? Asma, what do you think? Which is the subtest you prefer, like which you find easy?
Yes, ma'am. Easy.
Hello?
Yes, ma'am.
Yes, Asma. So tell me, like which subtest you find easy and which one is tough for you?
Writing must be easy, I think, and listening must be difficult, I think, in my
Listening
perception.
difficult and easy. What you said?
Writing.
Writing. Okay. Okay. Good. Then, Binuja, you can tell me about yours. Like, which is the subtest you find easy and hard?
I'm doing right now. I'm doing IELTS right now. Then I
Okay.
feel difficult in writing, or I feel easy.
Writing, you feel easy?
Not ma'am. Writing is I feel hard,
Tough.
tough.
Oh, okay.
Other
And
listening, speaking, I feel
reading.
easy. Easy.
Okay. 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 Nice. Nice. Okay. Then, Deepika,
For me, speaking is tough, ma'am.
which one?
Speaking is tough,
Speaking. Okay. Okay.
and reading and listening is easy.
Okay, okay, nice, nice. So what we can do, I will go back to this Nanu, but I would like to say, like tomorrow, like before starting the class, I can communicate, like we can do this task, like I can communicate with Deepika at the starting for 2 to 5 minutes about like Deepika, I can just communicate so that she feels confident. Is it fine?
Okay, ma'am. Yes, ma'am.
Okay. Okay. Okay, then Nanu, you can tell me about yours.
I think writing is hard for me.
Writing is
And then,
easy for
yeah,
you.
hard. No, no, no. It's
And
very hard for me.
okay, and then which one is easy?
The I think listening.
Listening. Oh, nice, nice. People find listening hard, but then it's good. It's okay.
Is
That's
easy.
good too. Okay, okay, nice, nice. Okay. So y'all now we'll go on to this scoring system, okay? So do you all know about the scoring thing? Like what is the max score you can get in OET?
No ma'am.
So it's basically it goes from 0 to 500. Okay,
Ma'am.
right? So there are different bands like A, B, C plus, C. Okay,
Yes, ma'am.
okay. So A comes in 450 to 500. Okay, B comes in 350 to 440. So basically, we need to get B in all the subtests. Okay, it's like the B is the effective communication. Then we have C plus, which is 300 to 340. And then we have C and below that is less than 300. Okay.
Yes, ma'am.
So your target has to be, what is your target, right? What is your target then?
Don't know, man. I don't know.
Huh? Tell me, Binuja, what is your target?
A.
A. Very good. Yes. Yes. You should always think like I will get to that A grade, okay?
Yes, ma'am.
And you all will. It's very simpler. It's like a simpler exam. You just need practice. You need to practice every day. Okay?
Okay, ma'am.
Okay. Okay. So we will discuss now about the preparation strategies. Okay? So, effective OET preparation, which includes enhancing general language skills. It's like general language, how you will talk to a patient, and then for each section we have different strategies. The specific strategies, which I'll be telling you later in the later lectures. Okay.
Yes, ma'am.
So we need to uh, include the general language skills and then applying the specific strategies for each section. So we have listening, reading, writing and speaking. So we will be discussing about the different approaches which will help us to succeed. Okay?
Okay, ma'am.
You should always have a positive mindset within you, okay? Like everyone feels anxiety, and we need to just have a positive mindset, like what will go about, how will go about, and we will be preparing it every day, so you don't have to worry about it. Okay?
Okay, ma'am.
Okay. So you all want to start today with the subtests?
Okay, ma'am.
Okay, so which subtest should we start with?
Ma'am, writing.
Writing. We'll start with writing, or should we start with reading?
Yeah, ma'am.
We'll start with reading today.
Okay, ma'am.
Okay, ma'am.
Okay. So y'all have your laptops or y'all use phones?
Yes, ma'am.
Y'all have your phones or laptop?
Yes, ma'am.
Phone, phone, ma'am.
Laptop?
Laptop, ma'am.
Okay, okay. So can you all log into OET official website? Today I didn't get the material, so I will be going through the official website. Can you all go through that? I will just
Sorry.
okay. So reading, how many parts we have? Can someone tell me?
In 3 parts, ma'am.
We have 3 parts. Okay. What are those?
Part A,
Yes.
Part B, and C.
Yes. Okay.
Thank you.
Okay. Okay. Let me just open this. You all have the PDF. I will be sharing the PDF soon. But do you all have PDFs right now? Hello? Hello, students.
Yes, ma'am.
Yes, you all have the PDFs.
Yes, ma'am.
Which PDF you all are doing? Are you all practicing right now? Hello, Deepika. Okay, we can do maybe listening today then. Listening or we'll do speaking.
Okay, ma'am.
I need to give you the PDFs. So let's start with speaking, okay?
Okay, ma'am. And
Okay, with whom will like with whom I should take to communicate? Who wants to volunteer? Anyone wants to? Binuja?
yes, ma'am.
Okay, you want to go with speaking?
Okay, ma'am.
Okay. So let's first discuss about the speaking, okay? So there are two role play cards in the OET speaking tests. In each role play card, you will be given a scenario, okay, and role play instructions. You will have 2 to 3 minutes to prepare for the role play, okay?
Okay, ma'am.
The role play lasts for 5 minutes, and there will be a person in front of you, which is an examiner, which you call an interlocutor, okay? The person is playing the role of patient, a caregiver, or a colleague, okay? You will be assessed on your ability to gather knowledge. I mean, to gather the information. Like you will be given that role play card, and you need to gather information from the person sitting in front of you. Okay?
Okay, ma'am.
You need to offer advice, like what is there any advice you need to give it to the patient, or maybe the patient is asking for it, and respond appropriately to the given scenario. Okay? Each role play card is worth 18 marks, so a total of 36 marks are available for this subsection. Okay?
Okay, ma'am.
Okay. So do you have any sample right now, Binuja?
No, ma'am.
No? Okay. Okay, let me just see. So first we'll discuss about the main areas, okay, the what are assessed in the OET speaking tests, like your intelligibility, like how the candidate speaks, okay. It
Okay, ma'am.
basically includes the pronunciation, the stress of certain words, and the ability to make oneself easily understood, right? Like if you are speaking to a patient using medical terms, is that appropriate?
No, ma'am.
No, it's not, right? So you need to communicate with the patient in very simpler terms. Even if the term is really not understandable, you can't speak that medical term in front of patient. You need to make sure that you break down that term in front of patient and the patient understands it really good, like he doesn't have any doubt, like that, like, okay. Then second part is your fluency. Like candidates are assessed on their ability to speak smoothly and without hesitation, okay. Like little a minor pauses are okay, like in between you just pause and then you start speaking, those things are okay. That is a natural flow of conversation, okay. But you need to speak smoothly and without hesitation, you need to be confident, okay.
Yes, ma'am.
Okay, then we have appropriateness. This assess whether candidates use appropriate language and tone in a healthcare setting. They should be able to adjust their communication style in different situations, such as patients. Like we don't just get patients, right, in hospitals. We get their family members, we get their colleagues, right? So we need to adjust our communication style to a different situation or individual, right?
Yes, ma'am.
Yes. Then we have then the fourth point which is assessed is listening and responding. Candidates must show that they can actively listen to the concerns and needs of patients or other participants in the role play scenarios. You need to actively listen to the patient, what is patient communicating, and then you have to respond appropriately and provide information or advice when necessary. Okay, like if the patient is speaking about his or her concerns, you can't just interrupt the patient, right? You
Yes,
need to listen very patiently and then you need to respond to the patient, okay?
yes, ma'am.
Then you have gathering information. So, in the role play scenarios, candidates are often required to gather relevant information from patients or caregivers. They need to, like, if you want to gather information from patient, you need to ask appropriate questions, right?
Yes,
If you need some information from patient, you have to communicate effectively with the patient, right?
yes, ma'am.
Yes. And then the fifth point is you need to provide information also to the patient. The candidate should be able to convey information clearly and comprehensively to patients, caregivers, or colleagues. This can include anything, okay? Like in the role plays, you all can get the medical procedures, okay? Like medical procedures, any lung procedure, or any other operation. Okay, so you need to effectively convey this to the patient or family members that this is the procedure, this is what we are going to do, this is how the patient will recover in few days, in next few days. Okay, so it includes explaining medical procedures, conditions, treatment plans, and other health care related topics. Okay, then we have organizing information. So candidates are assessed on their ability to organize and present information logically. There will be different tasks. Have you all seen role play card?
No, ma'am.
No, okay. Okay, so role play card includes like ask the patient about his condition. It's like that. The first task is ask the patient about his condition, gather information, empathize with the patient. It's like that. Okay, so there are different tasks which are given on that role play, and we need to organize it properly. Like we need to present the information to the patient if we are given the role play card, and then we'll have 2 to 3 minutes to prepare for that role play. Okay,
Yes, ma'am.
so we'll be making points. Okay, the first question we'll ask is asked to the patient is this, the second we'll ask is this, the third we'll do is this. So we need to logically and summarize, we need to this about the organization of the points. It includes summarizing medical histories, the treatment plans, and other complex information. Like after the patient we have communicated, like we need to do this, so we will be doing this. The patient, we are telling the patient, okay, we'll be doing this surgery, the patient will recover in few days, like this. So you need to summarize the points. Okay, like after the completion, before ending your role play, you will be like, okay, I would like to summarize what we have discussed today. Okay,
Yes, ma'am.
then we need to have empathy and rapport building. Candidates are also evaluated on their ability to establish a positive and empathetic. What is empathy? What is empathy? What you all understand by empathy? Deepika? Hello, Deepika. Binuja?
Yes, ma'am.
Yes. Can you tell me what is empathy? What you understand by empathy?
Ma'am, is ability to understand and to share our feelings to another
Yeah.
other.
Yeah. It's like putting yourself in those shoes, in the patient's shoes, right?
Yes, ma'am.
Yes. So what the patient is feeling, you can just empathize with the patient. The patient is not feeling well. I can understand how you're feeling right now. So this is like such a powerful statement for the patient. You can build trust with the patient. When you empathize with the patient, you build trust with the patient, right?
Yes,
So it's also shows how you understand and how you are supporting the patient, and the patient will eventually trust you. And in this case, it will be your interlocutor, right? The person who is sitting in front of you. Okay.
yes, ma'am.
Okay, right. So the role play lasts approximately for 5 minutes. Okay, and it's basically related to nursing and healthcare. Okay.
Yes, ma'am.
Okay. Just find out. Let me just speaking. Okay, so what you all anything, any doubt you all have about the speaking, listening, reading, writing, whatever we discussed today? Any doubt you all have?
No, ma'am.
Slow.
Mhm.
No, ma'am.
Hello, yes,
No, ma'am.
no, okay, okay,
No,
okay. Okay, so what we can do today is y'all have any role play cards between y'all? Like I can pick up two candidates and y'all can communicate with each other, and I'll just see how y'all are going about. Is it fine? Hello.
Yes, ma'am.
Okay. So how will you introduce yourself, Deepika? How will you introduce yourself to a patient?
To the patient.
Yes.
Mm, okay. Myself is Deepika, and
Okay, nice.
I'm a nurse,
Okay.
and
I will be your I will be taking care of today. I will be taking care of you today.
I,
Okay.
yes, ma'am.
And it can change also, like if it's like a medical emergency, like there's a patient who is come with accident case, then how will you communicate? Like you have to how will you communicate to the patient that you are taking care? How will you do it?
In which setting, ma'am?
It's an emergency. You are in the emergency department and the patient has just met with an accident. Okay. So,
Yes,
how
ma'am.
will you communicate with the patient?
Okay. Firstly, I say, please calm down, and
Okay.
I'll be taking care of you, and it's
Okay.
and it will be
So, you will be saying, I'm nurse Nitu, and I will be taking care of you. Okay. In emergency department, you just need to give your name and introduce. You can't say, how are you doing and all those things. Okay. So if you are instructing, a patient, so there are different phrases which are used for OET speaking. Okay. So it's like, while when we instruct a patient, we say, it's like there are different phrases. Like, for example, I can give you, you can say, it's important that you understand. So here what you are doing, you are emphasizing and you are instructing the patient that this is what needs to be done, right? So this is the phrase. You can use it with patient, like, it's crucial that you understand that this medication needs to be, it's crucial. Okay. Then you need to emphasize ki this is important. If you don't do this, this can lead to that. So you need to instruct the patient. Then there are some phrases which suggest. How will you suggest to a patient? How will you suggest to a patient? Like, you should, it's like a phrase. Okay. If you'll say, you should be eating this to get well soon. Okay. Then we have, when we explain to a patient, we say one possible explanation. The other phrase can be, if there's if in the role play card you have a surgery name. Okay. And then if the patient is asking, what is this surgery about? So what will you say at that point? You can use the phrase like, let me explain to you about this surgery, right?
Yes, ma'am.
Yes. So there are different phrases which are used. I'll say all these phrases. Y'all can just listen to it. So while explaining to a patient, what are the phrases you can use? Let me explain. Then second phrase will be, what I'm trying to say is, okay, while you're explaining and you need to get your information properly to the patient, you can also say, let me try to explain that another way, right? When you are instructing, you will be saying, it's important that you listen to me. It's important that you follow these steps. It's crucial that you remember. Okay. Then while suggesting, we'll say, why don't you see it in a different way? You will say, you out to. Okay. Okay. So how will you explain to a patient, Nanu?
Like if we talking to the patient, then first we need to tell them, let me explain. We need to start
Yes.
like, let me explain. And
Yes.
then the other way we can say, what I'm trying to say to you, like that.
Mm.
And then, yeah,
Yes. Yes. Okay. If you want to suggest something to patient, what will you say? You what will you say? You shouldn't be doing this. You should be following this so that you can recover quickly, right?
yes,
Okay. 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 So we can discuss about this writing writing also, like what are the writing things which are included in OET? What are the different writing letters?
Referral letter and discharge letter.
Which ones?
Referral letter
Yes.
and discharge letter.
Discharge. Okay. Okay. So there are different criterias which are assessed in OET writing. Okay. So first is articles. It's a and the. Okay. We often struggle with putting the application of articles. Okay. Like a and the. Then we have common adjectives. It's very important to use appropriate adjectives to convey the information accurately. Okay.
Okay, ma'am.
Then we have the nouns, which we'll be dealing with in further lectures, but I'm just giving you an overview. Okay. So nouns we have, for example, uncountable nouns, we have countable nouns, then we have verb tenses, then we have active and passive voice. So active voice will be I ordered an ECG and increased the dose of anginin. Passive voice will be an ECG was ordered and the dose of anginin was increased. Okay, we will be discussing everything. I'm just giving you an overview. Okay. Then we have relative clauses, we have comma, everything which needs to be put. Okay. Okay. So now we can discuss about the something about listening. So what are the parts in listening? Same like Biduja,
Yes, ma'am.
what are the parts in listening? There are different subtests in listening, right?
Yes, ma'am.
What are those?
Part 1,
Part.
part 1,
Okay.
part 2, part 3, part 4.
It's listening part A, B, C, D, right?
Yes, ma'am.
Yes, yes. Okay. So basically in listening subtest, there are 6 audio recordings which are played, okay? Right?
Yes, ma'am.
And it's basically workplace interactions, like doctor is communicating with the patient or optometrist is communicating with the doctor. So it's like it's usually the workplace interactions. Okay, there are 1 or 2 speakers, approximately the audio which is played, no, it will be 45 seconds each. Okay.
Okay, ma'am.
You will be provided with 3 option multiple choice questions per audio. Okay. And before start of the listening, you will get 15 seconds to prepare. Okay. So basically, this listening, what does your listening test? Like this part, what does it test? What you all think? Listening, what does it Tests. Can you tell me, Ashma?
Health related.
Yes, like I'm asking listening, like that subtest. What do you think? Why is it important listening? Why they have included in OET?
To have effective communications.
Yes, to
With it.
listen to the important things, right? Like if a patient is communicating, like if a doctor is communicating to a radiographer or maybe a patient, you need to, or maybe a simpler thing, a patient is communicating to a doctor. The patient will be saying all sorts of things. You need to pick up those important information, okay? Right?
Yes, ma'am.
Yes. So you are being tested on your ability to listen for the main idea of that interaction. Okay? The purpose, a speaker's purpose. What is the speaker's purpose? Why they are saying it, what they are saying, the attitude, opinion, the listener's course of action. You need to pick up the main idea. Okay?
Okay, ma'am.
We will be discussing it. So there are different tips which you can apply, like make the most of your reading time. We get the reading time, okay? Before the audio starts, we get the time. So we need to use it. If you are well prepared, like we will be practicing, right? Questions and sample papers. So if you are well prepared, you don't need to read the instructions, right? On the test day, you don't need to read the instructions. Instead, you can just go ahead and start looking at the questions, right?
Yes, ma'am.
Yes. Then, before each question, the context statement gives you information about the speaker or the speakers and the situation. So, use this to imagine being in that situation. What kind of language will you expect to hear? Before that, you need to just think about it, okay? Then you need to read the questions carefully. What is the plan for the patient today? If this is the question in the audio, the speakers might discuss what happened to the patient yesterday and what will happen tomorrow or next week. But your job should be focused on what? Binuja?
Yes, ma'am.
If the question is, what is the plan for the patient today? Right? You heard it?
Yes, ma'am.
Yes. And if the audio, in the audio, if the speakers might discuss what happened to the patient yesterday, what will happen tomorrow or next week. But your job should be focused on what?
My
Plan.
today's
No, no,
plan.
no, Minuja, the first question is, what is the plan for the patient today? If this is the question,
Yes.
okay?
Yes.
And if the audio is played and the speakers are talking about what happened to the patient yesterday, next week, what will be happening, what is your main goal to hear in that audio?
A bit confused, ma'am.
What? Okay, okay, Binuja, we are discussing which subtest.
Yes, ma'am.
Yes, Binuja, we are discussing which subtest, reading, speaking, writing, listening, which we are discussing right now.
Speaking, listening.
Listening. We are discussing listening, right?
Yes, ma'am.
Okay. So if The question is, what is the plan for the patient today?
Yes.
So, what will you try to note down from the audio clip? What will you focus on?
Ma'am, today my net is so unstable, so I do not hear you properly.
Okay, 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 no problem. Okay. Okay, students, you all have any doubts? Whatever we discussed today?
No.
Yeah, Ashma,
Yes, ma'am.
you all have any doubt? Whatever we discussed today?
No, ma'am.
Okay, okay. So, you all will be reading about this. Hello, Minuja?
Yes, ma'am.
Yes, you all will be reading about this. We will be starting from tomorrow the actual PDFs and practicing. Okay.
Okay.
Okay, ma'am.
Yeah. Any doubts you all have?
No, ma'am.
Nothing?
Last.
Deepika, anything?
No, ma'am.
Okay, Nanu,
No, ma'am.
Binuja.
No, ma'am, no problem.
So you all understood everything.
Yes, ma'am.
Okay, so read about all this and we will be practicing from tomorrow. Okay.
Excuse me, ma'am, I want to ask one question.
Yes.
Ma'am, about this not subject. Ma'am, if I'm doing here OET in Nepal, yeah, then
Mm.
when I go to UK, then
Mm.
can I join their hospital or what should be done to join hospital in UK?
First, you need to give OET, right?
Yes, ma'am.
Okay, if you clear it, then the different agencies will contact you. Okay, UK for UK and all different agencies. It depends on your score, right?
Yes, ma'am.
Yes. So they will contact you, and there will be vacancies in their hospital that they will communicating to you,
Mm.
right?
Directly,
So yeah.
directly I can apply there, ma'am.
Yes, yes. They will be telling you that we have these many hospitals where vacancies are there, and you can choose on that thing. Okay.
Okay, ma'am.
Yeah. So this is the first time you are giving OET.
Yes, ma'am.
Okay. Okay. So is it like scheduled? When is it when you have to give it? You all have booked anything?
No,
No,
ma'am. Still, I
ma'am.
am prepared for you. I am preparing IELTS class.
Ah,
Then IELTS book, not OET book.
okay. IELTS book you have.
Yes, ma'am.
You
I
are
have.
preparing for. You were preparing for IELTS previously.
Ma'am, I am preparing IELTS.
Oh, you are preparing IELTS.
Yes, ma'am.
Okay, okay, okay. Okay, you find it easy, IELTS?
Ma'am, writing section is
Easy.
tough.
Okay, okay, okay. So when you all are planning to give Deepika,
Yes, ma'am.
when you all are planning to give,
No, no.
how? You all have something on your mind like I want to answer this year, maybe next 6 months.
After covering this session,
Hmm.
then I will examine myself whether I am ready for or not.
Hmm.
If I score very good marks in
Hmm.
practice, then I will ready for the exam.
Okay, okay. So are you practicing? Will you all be practicing? Start practicing.
Yes, ma'am. Little by watching YouTube. That's more.
Yes. And I will be sharing, like, we have this official OET site. Do you all know about it? OET.com.
Yes, ma'am.
Yes, ma'am.
Yeah. You all know about it?
Yes, ma'am.
Yes. So you all can go to that site and have those PDFs. We will be discussing it from tomorrow, but you all can just take a look, okay? How is reading, writing, speaking, listening, okay?
Okay,
Okay,
ma'am.
ma'am.
And if you all find it tough, we can discuss it tomorrow, okay?
Okay, ma'am.
Okay.
Okay. Thank you. Okay.
Thank you, ma'am.
Thank you.
Mm.